Hello, so my name is Ellen Gavin and I am the Health and Wellbeing Lead at Irish in Britain. Irish in Britain is the national membership body for Irish community organisations in Britain. Last year we celebrated our 50th anniversary. We now support a membership network of over 130 community organisations who play an integral part in bringing Irish in Britain to life. Our membership consists of a wide range of societies, groups, clubs and services. The Irish community is the oldest ethnic minority community in Britain. In the latest 2021 census, nearly a third of Irish residents were aged 65 years and over, and this is up from a quarter since the 2001 census, so these numbers are only going in one direction. This ageing profile means a large percentage are vulnerable to illness, with only 50% of white Irish reported being in good health in the 2021 census. The Irish community in Britain have poorer health outcomes, in some cases worse than many other BAME communities. Furthermore, the persistence of community-specific health issues among the Irish community contributes to an older population at greater risk of premature death. These potential risk factors that are particularly prevalent among the Irish population in Britain include high levels of cardiovascular disease, disabling long-term illnesses, high levels of cancer and dementia, many living in single pensioner households and being socially isolated, as well as poor screening uptake. Heart health continues to be a sizable concern for the Irish community, with clear evidence of higher and in some cases increasing mortality among Irish men and women from coronary heart disease, hypertension and stroke. Our national heart health campaign, Green Hearts, is centred on a collaborative community approach towards improving health outcomes for the Irish community and promoting a positive message around prevention and early detection. Through our Green Hearts work, we support our member groups to prioritise heart health through training, resources, blood pressure screening and events.
Okay, following on from Ellen, cardiovascular disease is the leading cause of morbidity and mortality around the world. While mortality from cardiovascular disease has declined over the last 2 decades, it remains Ireland's leading cause of death after cancer. Due to its hereditary and genetic nature, it's important to address the prevalence of heart disease within the Irish diaspora living in the UK. The Green Hearts campaign, Irish in Britain's blood pressure and heart disease programme, aims to raise awareness of hypertension and heart disease within the Irish community. This includes first, second, third and fourth generation of Irish population. Irish women are 7 times more likely to die from cardiovascular heart disease than from breast cancer. A preventative approach to coronary vascular disease is needed at all stages of heart disease, from lifestyle changes and modifying the risk factors to early identification and treatment due to the preventative potential of heart disease. For this podcast, we've invited Dr Seamus Banim, consultant cardiologist with 50 years experience in cardiology, in conversation with Paul Moran, professional footballer from Tottenham Hotspur and England, of 4th generation of Irish descent, who had a bypass surgery 3 years ago.
So, good to be in the presence of a Spurs man today. Bit shattering to find that he's had a bypass a couple of years ago at a relatively early age. Paul, tell us about it.
Basically, I looked at myself as quite an healthy person. Yeah. Obviously, I had a family history, but basically, I was getting this a light flutter, if that's what they called it, and obviously got referred. And when they went in to see what the problem was, it found out that I had 2 slight thickenings in 2 of my arteries.
Yeah. And Paul, you knew you had blood pressure.
Yeah, I was on blood pressure tablets, which I thought would be under control with them.
And I think you told me your dad and your uncle had both died of heart disease.
That's correct.
Wow. And anyone else in the family?
The other brother is still going strong, but he has had an heart attack.
Yeah.
I think that was about 70 years old. So.
Yeah. I mean, this is important. Once you've got heart disease in the family, it's important for anybody to ask around, has someone else got a problem? And you can lead on from there. If there's a member of the family with heart disease, it's worth getting yourself checked out rather than just waiting.
Yeah.
Because certain things run in families, things like blood pressure, which you mentioned, and high cholesterol. Yeah. And then there are situations where some families tend to be obese and some families tend to be smokers and so on. And of course the other thing is some families have a propensity to blood pressure as well. But the interesting thing about you, Paul, is that you are very fit. And in general we think if someone is fit, if they're exercising, that is pretty preventative. And indeed, we encourage people to remain active and to stay fit. So in some extent you're unlucky, and it shows you just how strong a family tray can be in some situations.
No, that's right. Obviously my dad died at that age, so I was always aware that something could happen to me. Hence why I kept myself reasonably fit, ate healthy.
I mean, I tend to say that to my patients that, and to people I talk to these days, this is actually an acquired disease. You don't have to get heart disease. It's not an infection. It's something that if you look after yourself in general, you won't acquire it. You don't smoke. You keep fit. You watch your blood pressure. You don't get overweight. And those things go a long way. Now, there are issues nowadays for women who are busy, who are active, they're looking after their family, they're out working, and we've heard earlier that heart disease is 6 or 7 times more common as a cause of death in Irish women than breast cancer. So we need to be aware of this, and we need our Irish females to think about this and think about, as they age, come to the menopause, whether or not they should be on drugs like HRT. But it's difficult for busy mothers to get exercise, but I believe any exercise is good. Sometimes people stipulate you must go here and you must go there, but I think walking is probably as good as most exercises. You just need to make time for it.
So I'm quite amazed to see that it's quite a dominant feature of a woman to get heart disease.
Yeah, that's right, Paul. A lot of people, women, focus on breast cancer, but really heart disease plays a much bigger part, especially when women come after the menopause. You see, their ovarian hormones, estrogen in particular, protects them up to 45, 50 years of age, but then they start to catch up on the males, and so as they age, they'll have an increased propensity to heart disease. And I think this is something that's not really well flagged up. So women need to look after themselves. They need to look after their blood pressure in particular. They need to look after their exercise and obesity. There is an additional problem for women in that sometimes they don't have the usual presentation that men have. It's just odd. You have to be very careful trying to make a diagnosis of heart disease in women. I mean, their symptoms sometimes a bit different, and it's not clear why this is. But you can talk to a man and he'll tell you he's going to the tube in the morning, he's going up the hill, and he starts to get discomfort in his chest, stands waiting for the train to come in, everything settles down. You don't get that kind of straightforward history with a woman. And I've found this time and again. They'll have episodic symptoms, and it's difficult. And sometimes it's because there are other things going on. They've got sticky platelets or something else going on. But the disease process, the presentation, I think we're we're not as good as we should be at picking up on heart disease in women.
Obviously, I'm aware of my blood pressure now, but obviously I didn't know I had high blood pressure at the time. I speak to a lot of my friends. They're all in denial, never been to the doctors, never had their blood pressure read. All think they're invincible, but no one is. And it's just something you need to do, either at home, either at the doctor's, either at a chemist. You can always get your blood pressure checked. So wherever you feel comfortable, just go and get it, because you'll never know. Obviously, I was never aware that cholesterol was a big factor of a heart condition, but obviously I thought my cholesterol was in a safe place, but until I went into hospital and had it rechecked, it wasn't. So, and I was unaware of that, thinking I was in a safe place. Also, you can prevent things from getting high cholesterol, i.e. staying in minimal area of drinking alcohol, also not smoking, eating healthily. There's a lot of things to help yourself.
I agree, Paul, and thanks for bringing up the cholesterol issue. But there are other things. There's alcohol, which is a social habit for many Irish people, can be an issue, especially with binge drinking. I remember in the Thatcher years, because I worked at Bart's, we saw a number of men who were drinking just at lunchtime. Mind you, it was a long lunch, and their heart suffered. They developed atrial fibrillation, they put on weight, and some of them went into heart failure. So I think we need to be aware as Irish people that alcohol needs to be kept under control. It's coming up to Lent, so maybe it's a good time to think about it. One of the things that has struck me over the years is for me, the change in how heart disease is managed. Back in the 70s, we were talking about coronary bypass surgery, then we had angioplasty and we had stenting, and it was very much an operative mechanical intervention. But I reckon now that GPs probably do more for patients with, or for people with heart disease in terms of preventing it. They've got statins, they've got blood pressure lowering pills, they've got beta blockers, they've got aspirin. I mean, these are the things that are saving lives today, far more than your interventional cardiologist, as I was. But I was talking with Paul earlier on, there's a huge reticence, especially among men, to go on to statins. They'll duck and dive and they'll think, I can lower my cholesterol. And it tends not to work as well as it should. And the reticence is there. I would say to people, why don't you try them? See what it does to your cholesterol. Everybody's concerned about side effects. Well, let's see if you get side effects. Take them for a week, take them for a fortnight, see how you feel on them. But don't dismiss them. I would say the same about blood pressure lowering. Everybody thinks that, I'll exercise a bit, I'll lose a bit of weight, I'll stop my salt, I'll do all those things, I'll cut back on my alcohol. But, it may hold the blood pressure, but it may not get it into the right ballpark. So go for the pills, go for the blood pressure pills, go for the statins. They really do save lives.
So everybody's obviously suffers with stress. It's the way you deal with handling the stress. Maybe some people socialising may relieve it. Exercise, definitely, in my eyes, helps relieve stress. But it definitely ain't when you start drinking, thinking that's relieving the stress. That obviously can make it worse.
Finally, bringing this podcast to a close, could we have a take-home message for our listeners from both of you?
What I would say to men and to women Don't be afraid to get things checked. Don't be scared to find out if there is something wrong with you. And if there is, there's things you can do to sort it.
There's an awful lot can be done today to sort out and to prevent heart disease. The medicines are amazing, and simple things, exercise, being fitter, being slimmer, being more active. Simple things. Eat properly, watch the processed foods, the ultra-processed foods, and you'll do fine.
Thanks very much to Paul Moran and Dr Seamus Banim for joining us today. This will be the start of a series of podcasts that we will be doing as part of our new Healthy Ageing project. And thanks to everyone who listened today.